Questions for me?
I always wash my face before I go to bed. Should I mean, because it's already evening.
Yeah.
Do I do that still like normal?
You do that still like normal. You don't want to exfoliate, you don't want to rub anything, but just like if you had eye makeup on, you would take your eye makeup off the normal way with a makeup remover and a little cloth, and just wash your face, pat it dry. You can apply your nighttime routine, whatever it is that you use for your nighttime routine. Yeah, that's fine. You just don't want to excessively rub and move the tox that's been injected from one muscle maybe into an adjacent muscle where we didn't want it to be. Okay, so I'm going to start by disinfecting your forehead and all the places that we're going to inject, and we're going to let that dry. Once it's dry, we're going to put some markings up, and we do that because I like to keep track of exactly where the tox went in, so that I know at your follow-up where you need some additional units, and then we can kind of together devise a perfect plan and perfect markings for the areas where you would like still to have some movement, and for some other areas where we're okay with having very minimal movement. So this is a disinfectant, and thank you for not wearing makeup. If you did come with makeup, we have makeup wipes and washcloths in the restroom. This is your first time getting tox. What do you think?
Excited but nervous.
Nervous? What are you worried about?
Everybody, the poking.
The poking. Some people worry about not looking like themselves anymore.
Yeah.
Tox doesn't really change your look in a global way. An excessive amount of filler is probably what you think about when you think about someone who's overdone. The Hollywood doesn't help us there, either doing too much and not looking very normal and natural to most people, or they're just using olive oil. I think it was J-Lo who said that she uses olive oil, that's been the topic of speculation, and most people feel like that's not really a true statement. But everyone has the right to privacy.
Right. Sure.
So if that's what she chooses to share with her fans, that's okay. So we're gonna do some measurements and make some markings, and we're gonna start with your forehead, like I said, kind of high, and then see if we can inch down and relax a little bit more of the lower parts of your forehead. I'm going to ask you to frown for me like you're mad between your brows. Perfect. Up big? Okay. Relax. You're smiling, you're also squinting. Now, we could talk about bruising. It is possible to have bruising after tox injections. I do my best not to bruise you. I really do. Most people get bruised around their eyes if they're going to get bruised. I'll just ask you to close your eyes while I'm looking for vasculature. And this little guy just helps me to find vessels that I can't see with a naked eye, and then I'm able to avoid them. It sometimes happens because we don't exactly know where a tiny vessel is underneath the skin. That's kind of hard to predict if it's not visible. If it's deeper and we're in there, we may cause a little bit of a bruise. Turn this way. Now swirl up your nose like a bunny. You have some creases here at the top of the nose and also on the sides, and we'll get those all to relax as well. Now with your lower face, there are some markings that I do and measurements to make sure that we stay in this tiny, it's a pretty small muscle we're trying to find here on the lower face. So I'm going to make some drawings because anatomically we know where these muscles should be, and we believe that they should be about there. We're looking for a muscle that's called the DAO. Now if you make a sad face with your face, go ahead. Do you see that little bit of puckering? We're right there. Do that again. Yep, we're right there. That's the muscle that pulls everything down, and you can see that pucker. Now bring your chin up. There you go. This is going to relax. It'll look kind of similar to mine. And again, we use a moderate amount, enough to give you a desired change, but not really to stop all muscle movement, because we have the ability to add, but we can't really take it away once it's been added. We're gonna add one more injection site here and here, and what that will do is visually open up the aperture of your eye, and injecting high above here will kind of pull the top up a little bit and also help to relax. An important part of the process is to show the customer what product it is that we're using and the expiration date of the product. We're going to open this up and reconstitute it. What does that mean? Reconstitution means adding fluid to something that doesn't have any fluid in it. You can see that there is no fluid here. There's a thin powder that's at the very end of this very bottom of the jar. And so we need to add an appropriate amount of fluid, which is normal saline, to get this mixed up, to get the solid and the fluid mixed up so that we have something to inject. And again, the expiration date should always be shown to you, and you should know which medication is being injected. Today, we are choosing to use Jeuveau by Evolus. It's one of the latest FDA-approved neurotoxins on the market. What's special about this neurotoxin is it starts to work quick. About on the third or fourth day, you're going to see that it's starting to kick in and the muscles are more relaxed sooner, which is always a desired effect when people want, they want their treatment to start looking better right away. Another feature that I like this for is that it stays put where you inject it. It has very low spread, meaning for me as a provider, less chances of it diffusing from here into the lower part of the forehead, causing this kind of droop of the eyebrow. So now we're going to reconstitute. The way we reconstitute tox is to draw up some saline, inject it right into our vial, and now you can see that there's fluid here, and we just need to move it around, take the needle out, and swirl this around to make sure that everything is mixed in very well. So I'm going to come over here and kind of explain to you the dosages and why we're doing what we're doing. And this is going to be documented in your medical chart so that when you come back for a follow-up, we're going to know exactly where things went. And we've also taken pictures by the markings that are on your face. We've also taken pictures with a camera of the markings on your face, so that we know exactly how high above the brow we made our first injection, to see how your brows are moving. And then depending on that, we're going to know if we can inch it down a little bit. So we're going to start up here, and then the diffusion is going to take us to about there. I'd love to be able to get this line right above the brow, but I'm not sure that we're going to be able to get to it. But I think we'll be able to make these two better, because it will diffuse all throughout this area. This one, it's always hard to get. It's pretty low. We run the risk of giving you a heavy brow, which is not what we want to do. But next time we may be able to inch just even a few millimeters down the diffusion to kind of spill out towards this area without causing the heavy brow, but yet relaxing this ever so slightly a little bit more, and hopefully over a year or two to get these to relax completely, because we're able to inch down to them some more. The reason why we do our markings the way we do them is, and we measure them as well, is because we need to know exactly how high off the brow we made that first injection. As you can tell, we're going to have a spread of about like that from the injection of tox here. What we really want is to get at this wrinkle as well. We're probably not going to be able to do that on the first try. Next time we'll measure down a little bit more in 2 weeks. If we know we didn't cause a heaviness in the brow, then we'd be able to inch down just ever so slightly and inject right there to see if we can get it to spread a little bit lower without causing an unintended side effect. So we'll take pictures and measurements of your entire face and then keep it in your medical record just for us, so that we know which patterns we're kind of following. Okay, I'm going to give you this tool. It's a little vibrating tool. The body can't focus on too many things at once, so this is more of a distraction. Inadvertently makes you think about something else. So this works pretty well if you put it on the lower part of your face or on the bone, and it kind of gives a vibration. You can use either hand to hold it. In case we do get a bruise, and I'll see that pretty much right away, I'm going to ask you to hold this icy. So we're going to gently dab places where we're going to inject next. So the bunny lines are kind of stingy. I'm going to ask you to swirl up your nose like a bunny one more time. Relax. We're going to go right into that. And then swirl up your nose again. There's little lines right there that we can get. Relax. Doing okay? So now you're going to feel me. You're going to feel me palpate. Feel with my finger. that little notch, and I'm picking up your muscle off of it. Now I'm going to hold it, making a little bit of a dam with my thumb to make sure that the tox doesn't inadvertently leak into there. How's your pain?
Good.
Tolerable?
Yeah.
Did you think it would be worse?
Yeah.
That sometimes feels like a zinger because there's a little nerve there.
Mm-hmm.
Move to the top. So in terms of what things are going to look like in your social downtime, you can tell the little red marks, those are normal. They will go away by late night. In a couple of hours, they typically go away. You can put concealer on them right away, that's okay. What you don't want to do is rub your face hard. So that means no facials, no self-massage on the face, because what that will do is move the toxin from the space where we intended it to be to maybe a nearing muscle where we don't want it to be. Avoid exercise, saunas for the next 24 hours. Why? Because when you start to sweat, that kind of kicks up your metabolism. One thing. Another thing is you start to sweat and the tox can kind of not take as well in the muscles because you're sweating part of it out. Some people ask if they need to start moving their muscles like they did before, if they really need to make these movements to make it stick. There's no scientific evidence that that's helpful. It's not harmful, but it's not helpful, so that's not something you need to do. If you are thinking about getting a massage on other parts of your body and not your face, it's important that you lay on your back and not face forward. Again, when you're laying face down in a massage chair, that causes some pressure on your face and can make the toxin go into an area where we didn't intend for it to be. So I will see you in 2 weeks. Any questions about the follow-up? Okay. What would you say about comfort?
It was less uncomfortable than I was expecting, but probably wouldn't have been so without this. This was a great
Good distraction?
Mm-hmm.
Good, good. I'm glad it went well.
I always wash my face before I go to bed. Should I mean, because it's already evening,
Yeah.
do I do that still like normal?
You do. You do that still like normal. You don't want to exfoliate. You don't want to rub anything, but just like if you had eye makeup on, you would take your eye makeup off the normal way with eye makeup remover and a little cloth, and just wash your face, pat it dry. You can apply your nighttime routine, whatever it is that you use for your nighttime routine. Yeah, that's fine. You just don't want to excessively rub and move the tox that's been injected from one muscle maybe into an adjacent muscle where we didn't want it to be.
Okay.